Hello, and welcome to the FlowRy Show, a journey through life's tapestry, wisdom for every generation. On this show, we talk about where generations intertwine, sharing stories, insights, and dreams. Whether you are a seasoned sage or a curious young mind, we are all students in the grand classroom of life. Join Mike Ryan and I, Nicole Flowers, as we explore a tapestry woven with threads of collaboration, dreams, and lessons learned along the way. Today, our topic is around healing hands in the Nuba Mountains. Join us for an extraordinary conversation with Dr. Tom Catena, the only surgeon serving billions of people in Sudan's war torn mountains. His story of courage, compassion, and unwavering dedication reminds us of the transformative power of one person's commitment to healing. As we get into the journey of his calling and dedication, I just want to share a bit more color on Dr. Tom's story and his background. For almost 2 decades, he has been serving across Africa. Dr. Tom, he has been working in regions devastated by conflict, as you can imagine. He performs everything from complex surgeries to delivering babies, often under the most challenging circumstances imaginable. What drives someone to leave comfort behind and dedicate their life to serving in one of the world's most dangerous regions? For Dr. Tom, it wasn't a single moment, but a gradual calling, a deep conviction that everyone deserves access to quality health care, regardless of where they're born. Dr. Tom, welcome. We're so glad to have you on the FlowRy Show.
Thank you, Nicole. Thanks for having me.
Welcome, Dr. Tom. It's great to have you here. As we were talking beforehand, I grew up in a Roman Catholic family in Washington, D.C. I was privileged, as I tell people every day, to be born in the United States versus some other place that is less fortunate to where I was born. And, we try to do what we can. And I have a history of parents that design and build hospitals all over the world. I remember doing a podcast recently about some of the what do you see as the future as far as remote technology and the like, and where we have the greatest opportunity are in the continent of Africa. And you're literally hands-on there, and technology is one thing, but just basic supplies and logistics is an extraordinary feat, especially in a war-torn environment that you're dealing with every day. So God bless you. And I'm looking forward to hearing more about your journey, what you're doing now, and how our viewers can perhaps be able to assist you as you help those who are less fortunate than perhaps our viewers are at this day.
So Dr. Tom, during some of our conversations, you had shared about your inspiration and witnessing the profound gap between medical care in developed nations and the desperate needs in conflict zones. Just very recently, even right now, there's conflict that's all around you. Rather than feeling overwhelmed by the scale of suffering, you choose to focus on what it could be, what you could do, one patient, one surgery, one life at a time. Share with our listeners what inspired you to dedicate your life to serving in Sudan.
Well, thanks, Nicole. It's been quite a journey. Well, I guess it started back when I was in college. I studied engineering in college. I went to Brown University, and I thought I'd, go to college, do my thing, get my engineering degree, and get out and start making money. That's what I wanted to do. I was tired of school. I wanted to do my degree, do my thing, get out and be a rich guy, have a nice house, one picket fence, what have you. And then when I was in college, I started getting this itch. I grew up as a Roman Catholic, like Mike said, and I was always part of the church. And I started getting this itch that I wanted to do mission work. And I didn't quite know what that meant at the time. I met some evangelical Protestants, and they wanted to be missionaries. And I thought, well, that sounds like something I'd like to do. And that led me from mechanical engineering, which was not a job amenable to mission work, to go into medicine. So I actually went into medicine because I wanted to do mission work. And then over many number of years, extra years of school to the pre-med requirements, medical school, a year in Japan, time in the Navy. I spent 5 years in the U.S. Navy to pay off my medical school debt. Time as a family practice resident in Indiana. I was finally free to make a decision where I could go. And I decided I'd go to Kenya to do my first mission in Kenya. It was a fairly stable country, and there was quite a bit of need there. So I ended up in Kenya, spent 7 years there. And when I was there, it was great. I was doing great work. I really enjoyed it. I saw there's a huge need. I was learning a ton from very good, very senior doctors that really took time to teach me. But I kept hearing about Sudan when I was there. And people were saying, hey, if you think Kenya's difficult and a challenge, you should go to Sudan. That's where the real action is. That's where the real need is. And I had this, it's kind of, I guess not really a joke, but there's a guy named Willie Sutton. Hey, Willie Sutton was a bank robber.
Mm-hmm.
And people asked Willie Sutton, hey, Willie, why do you rob banks? And he said, well, that's where the money is. And for me, I saw it as, I'm a doctor. I have a certain set of skills that I can use. And this was where the real need was. And so I chose to go to Sudan. I wanted something that was more of a challenge. And I've been here almost now 18 years, and it has been a pretty serious challenge from top to bottom. But I wouldn't trade it for anything.
And that's so well said, Dr. Tom. You realize that you have skills that could make a difference in conflict zones. And you basically went, how could I turn away? Let's dig a bit deeper on working in a conflict zones. We can imagine aerial bombardment, still limited resources, overwhelming need. In one of our conversations, when we talk about you serving millions of folks and just the weight of responsibility on your shoulders, patients walking for days to reach your hospitals and to get access to your care. Share with us particularly challenging experience you have faced in your day-to-day work. I know everything is challenging, but what are some of the most challenging areas that you're facing today?
Well, I think one of the initial challenges was back in 2011, when the fighting started here. We had a group of expatriates that were here. They were Kenyans and Ugandans, and they were different professionals. They were nurses, trained nurses. We had a nurse anesthetist. We had midwives. And when the fighting started, they all evacuated. So I was the only doctor, of course, in those days, and I was left as a doctor and as a surgeon without any anesthetists, without any midwives, without any trained nurses. So that was a tremendous challenge to try to go. And I mean, they left at 5 a.m. 8 o'clock in the morning, we had 2 truckloads of wounded show up. They've been hit with an aerial bombardment. And I remember 2 of them were young people. One lady named Urshalim was about 18 years old. Her cousin was about 15. Both of them had their arms blown off. And you can't just look at that and say, well, okay, I'll give you an aspirin, go home. I mean, you got to do an operation to take care of it. So that was, one of many challenges. I'll take that. That was 14 years ago. You come to the future, Saturday morning, this is 3 days ago. Still, we're in a war situation 14 years later. We had truckloads of wounded coming. There's a battle a few hours from here, and I don't know, God knows, 20, 25 wounded showed up at a go. So all Friday night, Saturday morning, we were operating. And then I finished one case. It was a laparotomy, opened the guy up, finished that case, and the power goes out. And the guy that that normally does our was our facilities manager is out of Nuba for about 3 weeks, so he's not around, and power's out for 2 hours. I had 2 other guys waiting to go to the operating room. This is at 2 in the morning, and I was all ready to go. I was, kind of juiced up, and power's out. You can't do anything without power.
Right.
We waited. We went around. I got another guy up that I know. We kind of went down, looked at the generator. He was great. He managed to get. We got it. One of our mechanics, who's a car mechanic, that's the best we could do. We woke him up at his village, brought him back. Woke up another guy who's got some electrical knowledge, brought those guys in, put a new battery in the generator, managed to get it going. And we managed to finish those 2 cases at about 9 in the morning. Went home, I took a nap for about 2 hours, came back and operated till about 7 o'clock Saturday night. So these are just 2 things just off the top of my head, 2
Right.
typical challenges for working in this environment. We are extremely remote. You can't call in a technician that can come and help you. We're for the most part, we're on our own, and I thank God the guy who's a facilities manager is an absolute genius. A guy named Chris Lowe, absolute genius of a guy, but he's out, and he's the guy we can always count on. He's been here for 5 years now.
Wow.
It brought me back to the early days when I was responsible for the physical plant too, and I don't really have that much knowledge with this stuff. It was terrible. So anyway, there's no shortage of challenges, to put it lightly.
Just some context, Tom. What is in the general size of the population that you're serving for the audience, so they know that this is, and it's just like some people work remotely in different countries that are underserved and they're doing primary care. You're doing trauma, battlefield, triaging, and not just triaging, but doing the triage and then repairing someone's life or keeping someone alive, which is extraordinary. And thank you for the effort.
Yeah, we're about a 485 bed hospital, and we've got 19 peripheral clinics that we run, and we are the sole referral hospital for about 3 million people. That's all within Nuba Mountains. A lot of those people are displaced from the fighting further north. So a lot of people have been displaced into Nuba. Now, of course, the fighting is getting closer to us. We also get people coming from Darfur, people coming from the northern part of South Sudan. We've had people go from Darfur to South Sudan. They're referred down to Juba in South Sudan, referred from Juba up to us here in the bush. So we've got a pretty huge catchment area, and someone needs something done, they've got to come to us. We've got such a backlog of cases on the ward. We've got a kid with we got different people with abdominal tumors that I just need to put in the queue to get them done. We've got a kid with a spina bifida we need to operate on, trying to find time to do that. We've got people that need amputations, people with really terrible war wounds that we need to take care of, all kinds of stuff. People with cancers. We got, I think, 3 on the ward with cancer of the cervix, 3 women with cancer of the cervix. So 1 will operate on tomorrow. Other 2 I'm giving chemotherapy to first, and then hopefully in about a month or so, those tumors will shrink to the point where we can do the operation and get them a cure for the cancer of the cervix, which is normally very devastating. Normally they come too late, and we give chemo as a palliative treatment, but we can't do the definitive surgery for them.
Nicole knows this. I used to run hospitals in DC and Florida, Nashville, and one thing that and Louisiana, I was actually president of the Catholic Health Association of Louisiana. I was also the chairman of the American Red Cross, which just you talking reminded me of stop the bleeding, treat for shock, or whatever the thing is. I just forgotten it, but anyway, stop the bleeding, treat for shock, and whatever. I'm stuck. But who, if anyone else, do you have as far as medical professions or nurses or the like that are there to work with you at this point, with an extraordinary catchment area that you got on a daily basis, and overlay that with the being in a war zone?
Right. So, I mean, we're better than we were. We're better off than we were 14 years ago. So now we've got we've got 3 Nuba doctors who have finished medical school and internship in Juba. And they're brand new. They just joined us. You know, one guy joined us like 2 weeks ago. Another joined us earlier this year. Another one joined us about 2 months ago. So they're pretty new. So they're helping. They're kind of, but they're also in learning mode. We've got an Australian missionary doc who's with us part-time. She's part-time in the hospital. She's teaching a lot at our clinical school. We've got a school for clinical officers and midwives. We have another person who's in charge of our outreach, closed 19 clinics. And that's it for medical doctors. There's no other surgeon. There's no gynecologist. There's no pediatrician. There's not a physician, internal medicine doc. There's not a radiologist, whatever cadre of medicine you have. I'm kind of the consultant. I'm kind of the doc here, was done a residency training. And then we have the 3 junior Nuba doctors. And we have quite a few clinical officers, which are like PAs. And we just graduated our first class. We have our own school now. We graduated 19.
Oh, wow.
And they are fantastic. And they're a huge help. Really good people, smart, very helpful. We now have our own nurse anesthetist that we've sent out for training, and they're very capable. We have surgical assistants that we've sent for training who are very capable. So the level of help is quite a bit better than it was 14 years ago. And we're still a long way to go. And we're going to keep training people and taking our Nuba doctors that are junior doctors now and get them sent out to be trained as surgeons and pediatricians and whatever we think we need. We're going to keep going with that training pipeline.
And to our listeners, Dr. Tom and his team, they're very much interested in having conversation with retired medical doctors in the US and across the world who would like to come and spend a year or two and paying it forward. As he had shared, yes, they're upskilling in folks and they have provided their medical training programs, but there are still much more needs. And going back to the theme of this show, working across generations, from delivering babies to having open surgery because someone, again, they're in a war-torn zone and someone got injured and have to be operating on someone immediately. It spans the gamut. It spans the gamut. And these moments, not just tests or medical skills, which I know, or certified medical doctors across the world, you have this. You also have the courage and also looking for your commitment to spend some time in these regions to pay it forward. And, you know, Dr. Tom, as our listeners and us, Mike and I, listen to the challenges. You talk about the critical shortages of doctors, the lack of medical infrastructure, although it has improved since in the last 14 years, but the geographic isolation. So there's still infrastructure help that is still needed. I know, for example, like Wi-Fi and internet, this was a recent installation that had occurred. So I'm very thankful that this has happened. But there are also other infrastructure needs, going back to no reliable power, the limited medications, where the whole logistics and distribution to get medical supplies to the hospital. There are opportunities there for improvement and needs, as well as outdated equipment, where there also needs to get newer equipment so that you and your team can become more efficient. So we want our listeners and audience to be very much aware of there's that lack of medical infrastructure and also the opportunity to provide needs in their various capacities.
I got another question. Maybe goes back to my training as a administrator in a very non-warlike zone. Closest thing we came was DC, and kind of dealing with drive-by shootings, because I worked in the 80s and it was a murder capital world. But we literally had people. We had Georgetown residents there, and I ran the family practice residency program from an administrator point of view. So I understand when you have a new doc, right? What those transitions are like. But how are you? You're at what Mother Mercy Hospital.
Mother Mercy Hospital, yes.
Yeah. Where does, to be quite Crash, where's the funding come for your work? Because it's extraordinary, and how can people help and all that? I'm always looking. I've been a fundraiser for many human and places like the Red Cross and the Heart Association, stuff like that. How are you funded? And how because you never have enough funds, and especially what you're doing for supplies, equipment, staff, and all those type things. Can you share a little bit on that, Tom?
Sure. Thanks, Mike, for that question. Talk about the great challenges. That might be more the logistics. I mean, if you don't have money, you can't run a hospital. If you can't pay staff, they can't work for you. So
Right.
these are the kind of the albatrosses around our necks. 99% of our funds come from private individuals. The person sitting down at the kitchen table, writing the check for us to help our hospital. We have a few smaller foundations that contribute, but for the most part, it's private individuals that avail themselves of their own resources. I've got friends of mine that have downsized their lives to support us. We've got some great supporters. And what I was just out, actually, where I met Nicole was that I was out for a month. I was out for where are we now? We're in December. For latter part of October and the first couple weeks of November, I was out for a fundraising tour. So I was out, I traveled all over the place. I had 34 events in 26 days. The sole purpose was to raise money. Every day I was going somewhere different. I saw my family for a day and a half. The last day and a half, I was with my family. That was it.
Right.
The rest of the time I was raising funds because I had to get back because the doctors covering for me had to leave, had to come back, had to go back to the US and their respective places.
Wow.
So if we don't raise money, we can't do what we're doing. Anybody who gives us 5 cents, for me, they are an equal partner in this work. And I mean that sincerely. I'm not blowing smoke.
Right.
If you join us with whatever contribution you can make, you are a full partner with the work. We can't do anything without that support.
Right. Well, I will, and Nicole's heard this. I don't know if I say it every podcast, but I say it so often. Again, I was trained, most of my mentors were female, starting with my mother, but one of them was Sister Irene Krauss. She was in the Healthcare Hall of Fame. And she famously would say, if we have no margin, we have no mission. And so, it was so true. And so, a little bit different being in the US or in France or other places that are in developed country. But if you don't have donations or benefactors, then you can't do your work. You're the one literally on the front line of a battlefield. And, I will commit to you. I will do everything in my power and my skill set and whatever, because I'm not there. However, I can help going forward and reaching out to folks in my network, because I don't mean to humble you, embarrass you, or whatever, but I feel like I'm talking to a living saint. And I say that with all due, respect. I'm thinking in my head, I have friends that were the ambassador to the Vatican, right? Lindy Bogg, the family. They were the first governors of Louisiana. So, long-term, wealthy people, many people that went to Brown University that I know, that out here, that are in the tech world, that they need to hear your story, Tom, because it's extraordinary. I also thought of our first, Pope, American Pope Leo, right?
Yeah.
And, gosh, and the images that go through my 88th brain, I'm thinking of Mother Teresa and the work you're doing, and she did in Calcutta. So what you're doing is an extraordinary, and especially during this, quote, giving season. Today is Giving Tuesday in the United States, where people can write checks and stuff like that. And they I have found, having been involved with the Heart Association, my son was the largest fundraiser for them in the Western United States at the age of 7 or 8. And I think that you tell the story, you've got a great story. Obviously, you spent 23 or how many days or 34, presentation, but you can't do it all. And all I'm thinking, Tom, selfishly, not for you, but selfishly for the people that aren't getting your care because you aren't there to help them. But you can't help them, again, going back to the mission, unless you have a margin. And so, I am, pledging today that I will do however I can help in any way I can to use my skill sets to help you go forward. And I kind of maybe belabor, is there like a foundation, or is it the mercy of, and maybe you can give that information, we'll also share, but maybe you can tell us verbally what that is.
Sure. So we have three main partners that help us. So our primary donor, it's not a donor, we consider them partners, is African Mission Healthcare. It's a U.S. 501c3.
Right.
And founded by two American guys. One guy's Jewish, Mark Gerson, who's a Wall Street guy, and his best friend from college is John Fielder. John's a mission doc who lives in Kenya. So these are the co-founders, and they're in charge of the organization. And they established the organization to help mission hospitals like us
Got it.
that can't, like, I can't raise my own money. I don't know what to do. I can't write letters to people, but they can kind of organize a trip and get me out there and put me before a crowd. So African Mission Healthcare is our main partner, and they've got their own website. There's also a website called healthfornuba.com. And if you go to that, it takes you right to the giving page. And Sudan Relief Fund is another one of our main partners, and they've been with us for 25 years. And Sudan Relief Fund is based out of, I think, out of DC. They're also a US 501c3.
Right.
And the third one is Catholic Medical Mission Board. Has also helped us for many, many years. So those are our three main partners in the work. That's
great. I'm multitasker. I told you ADHD. I actually reposted about the photo of you with the gentleman at the African Mission. I'm sorry if I mispronounced it or whatever, and so I'm an action person. So I like I said, I want to help you, however, and we'll have an offline discussion as well on how we can do that, because I think that it's extraordinary that you're doing what you're doing in where you're doing it, but also getting out there and telling your story so people relate to people, they relate to the person that's actually doing it. It was extraordinary. Again, my concern is, wow, you just miss an opportunity, not you, but, having your skill set and your compassion and all that to, another person that comes in with a traumatic injury. So God bless you, man.
Thanks, Mike.
Yeah.
And to our listeners, just to reiterate how you can make a difference. You can learn more at africanmissionhealthcare.org and healthforanuba.com. And we'll definitely be posting this across the social medias, and where you can discover the full scope of the work Tom has been doing in the communities in Sudan, as well as you can support financially. You can financially contribute directly through the various programs from these websites, whether it be for medical supplies. They have their own training programs, as Dr. Tom had shared, from training nurses to physicians and physician assistants. So you definitely can contribute in that capacity, and as well as opportunity to volunteer. Retired doctors in the U.S. across the world, you have an opportunity to travel there and spend a year paying it forward. And as Mike shared, fundraising opportunities on their behalf and accessing the website. Every contribution, no matter the size, helps build a future where quality healthcare is accessible to all, regardless of geography or circumstance. Mike and I, as well as Dr. Tom, we firmly believe together we can transform lives and strengthen communities across Africa. Tom, are there any additional final thoughts that you'd like to share with our listeners?
Well, just reiterate what you said, Nicole. Any contributions helpful. If you are a person of prayer, I would greatly appreciate your prayers. We are under a quite a bit of stress right now with the war situation here, and I would really appreciate that. Enough said. I just really appreciate your prayers for us here, for our safety,
Absolutely.
for our protection, for our strength, and for our courage, more than anything.
Absolutely. You are, as I was told in catechism growing up with the Sisters of Notre Dame, the Christian Brothers, and the Jesuits. Be Christ-like, and I know someone has identified you as Jesus Christ, and you are what Christ had taught and teach, especially those of the Christian faith, to treat others as you would want to be treated yourself. My goodness, you've got an extraordinary skill set, but even more is the compassion that you have as a human being for other human beings, and having literally the calling to leave where you grew up and to get an education, some of the finest in the world at Duke and elsewhere. And so you are definitely on a, they would say the old Blue Brothers thing, on a mission from God, right?
That's right. You're dating yourself, Mike.
No, I know. I got you by a few years, so God bless you.
God bless you too, man.
To our listeners, Dr. Tom Catena's work reminds us that extraordinary dedication can create ripples of hope that extend far beyond what we can imagine. One doctor, 3 million souls across multiple generations, infinite hope. We're building a sustainable future where local health workers carry this mission forward for generations to come. We want to thank you for listening, because together we can heal the world one community at a time. As we close out today's segment, sharing our stories creates a bridge between generations. It allows us to connect on a much deeper level as we have connected and visualized what's going on across Sudan, Nairobi mountains. Learn from each other's experiences and fostering understanding. Embrace the power of storytelling to build meaningful relationships and create a more connected world. Thank you for listening in. Thank you for being a part of this journey. And thank you for your vital contribution to Dr. Tom's mission.